Welcome to the Walking Doctors video tutorial. In this guide, we'll show you how to access the metrics page to view a snapshot of your performance data. You can locate the metrics page by opening the Walking Doctors Management panel and selecting the Metrics tab. The metrics page will now be displayed with visual and numerical data for reviewing your facility or system performance. At the top of the page, you can filter the information by selecting the time period and location. By default, the metrics page shows information for the past year to date and across all facilities on the WD system. In this example, we'll view demo data for the past year and leave the location box unselected to view data across the user's entire system. Please note, the data presented on the metrics page is designed to give a quick overview of your clinic's performance, and a more detailed and exportable dataset can be accessed in the Reports section. Our metrics page is divided into 3 sections to allow for a structured review of your performance data with a few callouts above each section to highlight key information. The left section displays patient information, with 2 callouts for the total number of patients seen and the % of visits that utilize protocols. Below these callouts, a pie chart displays the reason for visit with numerical data available by scrolling over a section of the pie chart. Here we can see 201 sick patient visits and 7 antenatal care visits. Below the visit types, you can view the method of payment and a breakdown of patient demographics by gender and age. Next, the middle section displays your quality data with 3 callouts to identify the percentage of cases where doctors adhered to Walking Doctors quality checks for diagnosis, treatment, and education. Below these callouts, we highlight the top 20 most common diseases and conditions. This allows managers to see where doctors need support or where to highlight successes. To the right of each diagnosis, we identify the provider's adherence to standards for diagnosis, treatment, and education. You can see that the triangle or circular markers above these percentages correspond to the callouts above. In this case, the most common diagnosis is for corona or viral lower respiratory infection, which had an 87% accuracy in diagnosis, 80% accuracy in treatment, and 73% of patients received education. Sometimes there are sentinel events like the transfer of sick patients or deaths. The manager can see the date of the event, the age of the patient, and the diagnosis. They can even open the chart to investigate further by selecting the green rectangular button, which will open the patient's chart in a separate window. The third section on the right side of the screen covers the business metrics with callouts for the average time per visit and the revenue generated during the past year. Below the callouts, you can view a breakdown of the waiting time, including registration, triage, and clinical examination. Pharmacy information can be found below the waiting time section to alert managers of the economics of their pharmacy orders, including the number of orders and the margins for each drug. We also provide a list of drugs that are nearly out of stock, with an estimated stock-out date based on current use, and a list of drugs that are currently stocked out. Thank you for watching this video tutorial, and if you have any additional questions, please contact a member of the WD team at hello@walkingdocs.com.